As we know, the eye is developing and the eye to brain connections are developing in a growing child. So not wearing the correct glasses at that age could lead to an improper circuit from the eye to the brain, and then we lose the vision, which in turn is called as the lazy eye. Hi everyone, I am Dr. Srikanth, consultant pediatric ophthalmologist working at Apollo Spectra Alvarpet, Chennai. So now we'll be discussing in detail about refractive errors in children. So refractive errors, or in common terms having glasses power in children, basically means that the power in the eyes is abnormal from what you expect normally in a child of that age. Any child who has a power which is beyond the range which is normally expected will have a certain type of a power. It could be either hyperopia or a plus power, myopia or a minus power, or astigmatism or a cylindrical power. So these are broadly the types of refractive errors which are found in children. So refractive errors are basically caused due to the dimensions of the eyeball. So the eyeball, as we know, is spherical in nature, and because of the size of the eyeball, you can get a spherical refractive error. Because of the shape or the curvature of the eyeball, you get what is called as a cylindrical or an astigmatic power. So spherical powers are basically of two types. If the eyeball is smaller in dimension, you get a plus power, or what we call as a hypermetropia. If the eyeball is larger than what is normal, you get a minus power or myopia. As I mentioned already, the cylindrical power or the curvature of the eyeball decides the astigmatism power. So refractive errors can be corrected based on the age of the child. So we have different options for correcting refractive errors. One is the use of glasses, second is use of contact lenses, and third is doing laser procedures. Laser procedures can be done after 18 years of age because that is when the eyeball stops growing. Any of these options can be prescribed to the child based on their needs and their requirements. So if we don't correct the refractive errors in children, then we land up in a problem what is called as a lazy eye or amblyopia. As we know, the eye is developing and the eye to brain connections are developing in a growing child. So not wearing the correct glasses at that age could lead to an improper circuit from the eye to the brain, and then we lose the vision, which in turn is called as the lazy eye. The earlier we start the glasses, the chances that we prevent from such things happening, and then the correction of these conditions also becomes tougher if we diagnose these conditions at a later age. Many school screenings have helped us prevent many of these eyes from going into amblyopia or lazy eye, and that is why early screening is done at Apollo Spectra Hospitals, and if we correct them early, we get the best possible visual outcome. Thank you.